This is the case of large ostium secundum ASD. ASD is so large that it simulates ostium primum ASD. So in this case, how you will make difference between ostium primum ASD and secundum ASD? First thing, you will try to find supramitral margin. In case you get supramitral margin, so this is supramitral margin, this portion is supramitral margin. So whenever you get supramitral margin, that indicates ostium secundum ASD. If there is no supramitral margin, any margin of interarterial septum above the mitral valve, in that case it is ostium primum ASD. Second thing, you have to find out crux of the heart, or you can say the valve from where it arises. In case of tricuspid and in case of mitral, should not be the same point. If it is not the same point, in that case it is ostium secundum ASD. If it is from the same point, in that case it means ostium primum ASD. Ostium primum ASD means both mitral side and tricuspid side of valve originate from the same point. In this case, you can see the tricuspid valve is originating more apical compared to mitral valve, not from the same point. You can see in this image, ultimately indicating this is large ostium secundum ASD, not the ostium primum ASD. At the same time, you are also seeing supramitral margin. This portion is supramitral margin. So whenever you find supramitral margin, at the same time the crux of heart is present, or you say the tricuspid valve and mitral valve are originating from the different point of interventricular septum, that means it is ostium secundum ASD. So this is the case of large ostium secundum ASD, not the ostium primum ASD. Again, you see the anterior mitral leaflet is prolapsing, leading to moderate eccentric mitral regurgitation. Right ventricle and left ventricle. Left ventricle is not making circular shape, indicating raised right ventricular systolic pressure. At the same time, right ventricle dilated compared to left ventricle. IVC is dilated. Again, you see the IVC is dilated. Again, you see right atrium, right ventricle dilated. The left atrium is also dilated. This is the size of ostium secundum ASD. This is main pulmonary artery, slightly dilated. You can see the bifurcation of main pulmonary artery into right and left pulmonary artery. Again, the same thing. You can see the moderate eccentric mitral regurgitation jet due to prolapse of anterior mitral leaflet. Whenever anterior mitral leaflet prolapse, jet will be directed posteriorly. When the prolapse of posterior mitral leaflet, that jet will be directed anteriorly. So prolapse of AML leads to posteriorly directed eccentric mitral regurgitation jet. Thank you.